Hello and welcome to the Learning to Slay the Beast podcast, a resilience podcast where we talk about all the challenging things that we're working to overcome, like anxiety, obesity, health, and relationship issues. My name is Sarah. Allergies are a big deal for many families, and in my family, all of us suffer from seasonal environmental allergies, and my daughter has food allergies. She was diagnosed at 18 months with allergies to eggs, cashews, and pistachios. It's something that I've had to learn a lot about in order to keep us well and also, in my daughter's case, safe. I'm excited to speak with Dr. Karen Kaufman. Dr. Kaufman is an award-winning and board-certified allergist immunologist. She received a Bachelor of Science from Pennsylvania State University and her medical degree from Southeastern University College of Osteopathic Medicine. She owns Kaufman Allergy, Asthma, and Immunology in Virginia, USA, where she's been honored as one of her region's top doctors, and today she's going to help us to understand environmental and food allergies. So welcome, Dr. Karen Kaufman, to the podcast. I'm so happy to connect with you today.
Well, thank you so much for having me here. This is just such a pleasure to be able to share with you and with your audience. So thanks.
Great. So why don't we start with you providing a little bit of a background about yourself and then how you became an allergist immunologist?
So when I was in medical school many years ago, I recognized that I have a knack for wanting to be with people. So for me, a medical specialty was definitely the right direction. So I actually did my initial residency, my initial specialty training in internal medicine. And, with internal medicine, we primarily care for adults. And going through the process of my residency training, to be honest, I didn't even realize that allergy and clinical immunology were a subspecialty that I could even choose. And so over time and into the second year of my residency, I was sort of moving in the direction of wanting to pursue cardiology. And I had a couple of challenging months of residency. And coinciding with that, a good friend of mine was a first-year cardiology fellow, and she was experiencing some of those same stressors and challenges that I was. And so it really left me second-guessing, myself to say, is this really what I want to do? I have no idea, And so then I did a clinical rotation in allergy and immunology, and I just felt so invigorated by the fact that we were really making major changes in the quality of patients' lives. And it was a lot different than really just temporizing medical problems that people had as they got older. So I really switched gears at that time and decided that I wanted to pursue allergy and clinical immunology. So it was the beginning of a very exciting journey for me.
Yeah, I love that. It's almost one of the more proactive kind of areas, right? That you're right, you can really affect the quality of someone's life.
Yeah, and also I think I really got excited about the fact that as an allergist immunologist, I get to take care of both adults and children, but within a spectrum of a certain subspecialty where I really could be providing expert care for people throughout their lifetime. And that was really exciting for me. So I really kind of latched onto it, and it all started to progress from there.
Great. So many of us are familiar with environmental allergies and some food allergies to some extent, but I wondered if you could explain some of the most common allergens and then some of the best methods for diagnosing and testing for allergies.
Sure. Excuse me. So, when it comes to environmental allergies, I live here in Northern Virginia, and here we have a major problem with pollen allergens, particularly in the spring, the summer, and the fall, which is when we encounter tree, grass, and weed pollen, respectively. Of course, we've got our furry animals and dust mites, which are our year-round allergens, and also mold spores, which are a problem for many people. When it comes to food allergies, by far the most common food allergies include milk, egg, wheat, soy, peanut, tree nuts, fish and shellfish, and also sesame, which is sort of just the next one down on the rung of prevalence. But also interestingly, and we'll talk about this, but as people move through adulthood, often, other foods, including various fresh fruits and vegetables, other, nuts, seeds, or legumes can become problems for them. So there's really a very broad array of what we see from both environmental and food allergy perspectives. When it comes to the time of diagnosis, a lot of times we will initiate that with skin testing, which is a really valuable tool to identify sensitization to various allergens. And I do that with skin prick testing, which is an epicutaneous test. Additionally, the other ways that you can diagnose environmental and food allergies are with specific IgE antibody testing, which is a serum test that somebody would have if they give a blood sample at a laboratory, and we run specific antibody testing to identify, again, sensitization to those relevant allergens. Certainly, there's a lot of other ways to test that are out there, and even I will say that there's a full industry that revolves around food sensitivity testing. And unfortunately, a lot of these other methods of testing are really just unvalidated and they're very minimally interpretable. So it's really important to consult with an expert to determine what kind of testing is the right place to start and the right place to progress to follow food and environmental allergens over time.
Yeah, that's a really good point that you bring up about food sensitivities. And I do have some of those where, I'm not allergic to them, but they do, certain foods react really negatively for me, like dairy. But yeah, I'm not allergic. And I know there's so much confusion with people where they'll think, like, for instance, my daughter has food allergies. She needs an EpiPen, but they'll think it's like, kind of say just a sensitivity sort of thing. And so, yeah, I think there is a lot of confusion out there with people. And so they're very different test methods, correct?
Correct. So some of those look at other things like IgG antibodies for food, which is completely different. Some of them do hair sample analysis. I've seen things like something called applied kinesiology. There's just a ton of different kind of non-validated methods. And unfortunately, it's really hard and it's become a big money product that's out there in the world. And as, especially with adults, we become very focused on, our health and our well-being and trying to, really be introspective to look at what we're putting in our bodies and symptoms that we have that may or may not correlate, that it's become a really big industry, which doesn't necessarily lead to answering those questions for patients. So unfortunately, when it comes to these food intolerances, which are really foods that cause our bodies to feel certain ways, but not because of anything that's happening in our immune system, the best way to diagnose those problems is by keeping a food and symptom diary and working with an expert, whether it's an allergist or a nutritionist, to work through those things. So yeah, it can be really confusing.
Yeah, no, absolutely. And like I said, especially when explaining to people that, like, no, it's actually an allergy, it's
right.
Diagnosed, and yeah, there could be, a severe reaction. So maybe you can dig into the kind of the reaction side. So what does actually happen in our body when we get an allergic reaction, be it from an environmental allergen or in the case of a food allergy?
Sure. So what happens in individuals who have allergy is that they make antibodies that are called IgE antibodies, which are specific to whatever the trigger of their response is, whether it's a tree pollen or cat or dust mites or peanut, right? It doesn't matter. So with exposure to these allergens, our immune system starts releasing these specific IgE antibodies, which act on receptors of various types of immune cells, which are then triggered to release some of their immune mediators into our bloodstream circulation. And as they act on their targets or their end targets, this is where we start to manifest symptoms depending on what's going on and what mediators are being activated. So not to get into the weeds too much, but usually the symptoms that we have of allergy just happen as part of this immune response. So the entire process is kind of directed by what our immune system is doing in the setting of exposure.
Okay, that makes a lot of sense. And so then in the case of anaphylaxis. That's like, of course, the, more extreme reaction that all of us, of food allergy children really fear. So I wondered if you could dive in a little bit more to that reaction, maybe explaining what symptoms we should be watching for with anaphylaxis. I've heard so much different advice. Some of that saying that, one symptom can be enough to be showing anaphylaxis. Other times I've heard it should be a multi-system reaction. And, like I said, as a parent, you're never totally sure what you're looking for. So I just wondered if you could dig in a bit.
Absolutely. So when it comes to anaphylaxis, symptoms typically fall within 4 major categories, or these are the body systems I think that you're referring to.
Right.
And I try to simplify everything and group them into big groups to help patients and parents remember them easier. So the 4 groups that I like to think about in the setting of systemic allergic response include the skin, the respiratory tract, the gastrointestinal tract, and the cardiovascular system. So as an example, when we're talking about skin symptoms, this could be something like hives or swelling of the skin. It could be generalized redness, itching, or even flushing. So lots of variation of skin symptoms, but all completely limited to the skin. And just to kind of give a quick follow-up on skin before going to the others, I've also heard a lot of kind of misinformation out there in the community. And some people think that it's more severe if you have skin reaction on your face versus skin reaction on your torso or whatever. And that's not true. So skin is skin. So if it's only affecting the skin, that's just one body system. The respiratory symptoms typically look like what we see in the setting of asthma. So this could be coughing, repeated coughing, chest tightness. It could be difficulty breathing or labored breathing, the feeling of being short of breath, or any audible aspects of breathing like what we call wheezing or stridor, which are both sounds that are abnormal that are made in the setting of respiratory obstruction. The gastrointestinal symptoms that can occur typically are related to swelling somewhere in the GI tract. So often, I always think about the GI tract as anywhere where our food goes from beginning to end. So we're talking about swelling inside of the mouth or in the throat. Swelling can also happen in the gut. And when that happens, we're really talking about manifestations of, severe cramping, abdominal pain, profound nausea. Often it's vomiting, or it could even be immediate diarrhea. So again, the body is trying to push it out and get it out some way or another.
Okay.
The cardiovascular symptoms, I think, are the ones that are the scariest, especially for parents with young children, because it's hard to really put your finger on it sometimes. And so, what we're really talking about are symptoms relating to a drop in blood pressure. So people might feel lightheaded or dizzy, or they may feel like they could pass out or lose consciousness. But of course, in a young kid, especially who may not be able to verbalize that, I always tell parents that it's always important to watch, your kid's behavior. And if they go from being kind of a normal, active, child, toddler, or young kid especially, and all of a sudden becomes suddenly lethargic immediately following an ingestion, to me, that's concerning. I mean, nobody's going to walk around with a blood pressure cuff on their arm, so we don't really know exactly what's happening. But to me, that would be a very worrisome sign as a parent. I would be on the lookout for that as well.
Okay. Yeah, that makes a lot of sense. And so are we looking for a combination of those? Like, obviously, if there's a breathing or a cardio issue, that seems like, super important for sure. But then, I've always struggled with, okay, I'm seeing hives.
Sure.
So now what do I do? Right? Like there's that, what's your response compared to what's going on? I think that can be really tricky. And then what do we do when we're really not sure, I guess, as parents?
These are such good questions, and they're so common because, it's not so straightforward in clinical practice. When you see your kid having a reaction, and then it's like, oh my gosh, how many body systems is this? What? It's very hard to put your finger on it. So what I typically tell parents is that anytime we're talking about a multiple body system reaction, then we should always treat that with epinephrine. So to me, that is systemic allergy. So, somebody comes in with, hives and can't stop coughing. that's somebody that really has, a lot going on, right? There's multiple body systems being affected, and multiple doesn't have to be 2. It could be 3, it could be 4. It's, a lot going on, but not just one thing, So for that, I would say multiple body system. Yes, we're going to treat. Any one severe symptom, I wouldn't wait for a second body system to be involved.
Right.
So if somebody is losing consciousness, or if they are losing their airway and they're not able to, oxygenate because they can't respire, for that, I'm not going to wait for a second body system and watch somebody struggle. I'm going to treat them, So to me, any one severe symptom is going to be indicative of using epinephrine. But the last question that you had, which is, what do we do if we're not sure? Epinephrine is the same thing as adrenaline. Okay. So it's a life-saving medicine, but it's also something we all make in our bodies. So epinephrine is not harmful to us. So even if there's not a very clear-cut or strong indication to say, yes, you absolutely have to use it, I would much rather have parents or patients err on the side of caution and use it even if it's not 100% necessary because they're not sure. So, I always tell parents that, if you're thinking to yourself, should I use it? Should I not use it? Or maybe mom and dad are going back and forth between each other. Yes, no. Or they're like, where's my action plan? Or how many body systems is this? Or do you remember how to do this? Or should we go to the emergency room? Or should we just call the pediatrician? Or should we just give Benadryl? Just do it. The answer is yes. So my rule of thumb is if you consider it, the answer is yes. And then they should go ahead and use it. And even sometimes parents really struggle with that. And they're like, gosh, I still don't really know. And then that's the, group 3 subletter A is just do it because your doctor is telling you to do it. Like you really just need to treat and do it and seek emergency care and let the professionals take over with continued monitoring. And, patients may need additional medications following the use of epinephrine. So it's always best to seek emergency care and to allow the physicians in an emergency department to be able to assess, to observe, and to treat.
Yeah, that's really helpful too. And I think one of the things that's been surprising to me is that, sometimes you're very well aware of the food allergy that your child has, but things will be, that allergen could be hidden in something that you don't expect. And so, I think I always imagined like, oh, I would see her eat that kind of nut and then be like, oh my gosh, you need a treatment, where it can be very sneaky and it can be very difficult to know what's going on, especially if there could be something that has been cross-contaminated or something like that. So I think that's really great advice for parents.
Absolutely. I mean, for as much as we, teach patients and parents to read ingredient labels, and, of course, fortunately, there are labeling laws in the U.S. where some of the most, common food allergens have mandated clear labeling, even with strict avoidance that we're all practicing, accidental ingestions happen. That just is part of it. And cross contact is very difficult, so, we think, well, we can read labels and we can avoid food allergens, sure. But where most problems happen are, in a kitchen or in a family member's home, or maybe in a restaurant or a bakery or something where you just don't recognize that those ingredients may be mixed. And it may be something as simple as, using the same spatula to remove a sugar cookie off of a tray that was used for peanut butter cookies earlier in the day or something like that. And it's just that trace amount of protein that may be enough to elicit a response. So it's just really important to manage it properly, which includes avoidance, but it also includes adequate emergency preparedness. And, reactions happen. So we want to make sure that we have a plan in place and we have emergency treatment available at all times.
Yeah, no, absolutely. And it can be really tough for the kids. I mean, my daughter's only 8 and we've been dealing with this since she's 18 months, but there's been times where, we've ran out somewhere and I don't have her EpiPen and she's saying like, well, can't I just have a popsicle or something? But my rule is no food. Like no EpiPen, no food, right?
Yeah, absolutely.
So, it's, we've had to have those tricky times where it's like, no, we got to go home. Like you just cannot have it. And, it takes a lot of diligence on the part of parents. And I've made mistakes for sure. Like where there's been times where, you just don't think it's there and you've read it twice and you're still, it's tough to always catch it. So
yep, you got it. And even I think it's hard too, because a question that a lot of folks will ask is, what if I have a packaged product that says it doesn't contain whatever the allergen is, but it may be processed in a place that processes that allergen, or there may be trace amounts in there, like accidentally, even though it's not part of the product that the patient would be eating. And, the answer is you have to be prepared for the fact that it could happen at any time. And so strict avoidance includes avoidance of any possibility. So, I agree with you. I think no EpiPen or no epinephrine autoinjector, no food. I'm totally with you. But also, being really cognizant of the fact that, even sometimes people will say, well, I've had such and such food, packaged food before that says could be processed in a plant that processes the food allergen I'm trying to avoid, so it must be fine. But it's really just, there was good luck on your side on those occasions, and it certainly can happen. So we want to be really cautious.
No, that's a good tip too. So can you provide, I guess, a little bit more in terms of what we can do to treat environmental or food allergies, and then maybe how effective some of these treatments are?
Sure. So, that's a very broad question, so I'll try and condense my answer as much as I can. When it comes to environmental allergies, I really like to take a very 3-step approach to management, which really includes, avoidance of triggers as much as possible. So this is what we call environmental control measures, or tips for patients to help them to reduce exposure to their allergens, or at least to reduce the effects of those allergens on them. So environmental controls, pretty much it's as much as we can do without necessarily needing medication. We should do all of that first. For folks with environmental allergies, a lot of times it's medication therapy. And sometimes that starts with simple things that are, now available OTC, where anyone can go into their local, drugstore and go just pick something up and take it for symptom relief. But there's lots of different, pharmaceutical, prescription therapies that are very effective for symptom reduction. When it comes to management, in the long term, a great option for many people with environmental allergies is allergen immunotherapy, which is a customized treatment modality that involves changing the way that the immune system recognizes allergens. So we're kind of getting more towards fixing the underlying problem rather than treating symptoms associated with that problem. And so with immunotherapy, often, the outcomes that we see are reduction in symptoms from environmental allergens, reduction in need for medications, and significant improvement in quality of life. So those are some of the main ways that we manage environmental allergies. When it comes to food allergies, unfortunately, we don't have as much of an option. So really, we're talking about, adequate avoidance, education to learn how to best do that, and emergency preparedness. But there are some treatments that are on the horizon, and things that are, much newer on our kind of treatment armamentarium is to looking at things like oral immunotherapy specific for peanut, which is kind of one of our newest methods of treatment on the horizon for management, which that really involves, of course, in a monitored setting, in the presence of a physician, to start introduction of very, very small trace amounts of peanut allergen that are typically below the threshold that would contribute to symptoms, and very gradually, increasing that exposure. And this is done through ingestion. So it's a little bit different compared to with environmental allergens, which for the most part, we do that subcutaneously, although there are some sublingual options as well. But with oral immunotherapy, I think, the point of doing that is not to allow someone to all of a sudden be able to make a peanut butter sandwich, or to no longer need to carry their epinephrine autoinjector with them. But it's really to kind of raise the threshold of the amount of ingestion of peanut protein that a patient might need to have to elicit a reaction. So for some people, that's a great option, and it's not a great option for some people as well. Just like any medical therapy, we really need to look at, the pros and cons and risks and benefits, and to choose the modality of management that's best for any patient or family.
Yeah, so that makes sense. So, yeah, I had allergy shots as a younger person for my environmental allergies. So that's kind of what you're talking about with the immunotherapy there,
Correct.
right? Yeah,
Yep.
yeah.
Yep. You got it.
Yeah, and it's funny because I didn't see a huge reduction at first, but as I've gotten older, I have much less reagents. So I do think that it
Yeah.
was helpful in the long run. And that is very encouraging to hear about the work going on with peanuts. Have you heard if they're kind of looking to expand that to, say, the top 8 common allergens or for food?
I think there's a lot of excitement in the realm of food allergy on the horizon. So I know that there's lots of clinical trials that are going on, and we're going to see over the next, I'm sure, 5 to 10 years, some significant advances in the management of food allergy over time. But the thing that's so hard is that, there are some food allergens, like, for example, like milk, wheat, and soy, which many children will grow out of them on their own over time. And, I would say to a lesser degree egg, and to a much lesser degree, peanut or fish and shellfish, tree nuts. Some of those are much more persistent into adulthood. So, we want to look at that too, because, to some degree, we'd rather allow, a child an opportunity to grow out of food allergens if they're able to. So that way, they're not in the realm that they need to continue avoidance once they've successfully grown out of a food allergen versus, having to, eat that trace amount or small amount of their allergenic protein, every day indefinitely. It's kind of like the ongoing management of hypertension or diabetes. Like, you just have to kind of keep going with it. So, so it's tough, and I think patients and parents need a lot of counseling about that kind of stuff when it comes to helping them to choose what the right path is for them and for their family.
Right. And that was kind of what we were told. Like, my daughter has eggs and then tree nuts, and we were told it's pretty unlikely that she would outgrow the nuts, but the eggs, more possibility. So yeah. It's hard to know for sure. And maybe, we can kind of touch a little bit on that. Like, how does that happen, I guess? Like, so for a milk allergy, and you do hear that a lot of even younger babies that have it and then have outgrown it. How does the immune system just get stronger?
It's sort of a development of a change in immune recognition that happens over time. So it's not really necessarily a strength of immunity, but sometimes the way that we recognize allergens does change a little bit in time. And so, one thing that we'll see is that depending on the form of the allergen, sometimes it's better tolerated. Like, for example, in a child, let's say, who has a history of milk allergy or even egg, and we think, okay, well, we think that the child may be growing out of their allergy. When it comes time to do what we call a food challenge, which is a monitored trial of introduction, we tend to want to do that first with the food in the baked form. And the reason why is because of the structure of the protein. So, the best way I can kind of make a visual picture of this, these are called conformational epitopes. So, like, if you have, let's say, a ball of yarn, right? So I'm a parent, and we have a big ball of yarn in our craft cabinet. So I think this is something that maybe other moms can relate to, right? So this ball of yarn has fallen out of the craft cabinet about 100 times. It's a tangled up mess. Okay. So this messy ball of yarn, let's say I took a magic marker and I drew a line around half of the ball of yarn, right? So now I've got this really smooth line around this really messy ball. If I tried to line that up with a curved kind of receptor, like maybe if I made a C shape between my index finger and my thumb and I stuck that ball of yarn right in there, it would line up perfectly. And that's kind of like egg allergy, for example. But when we bake it or when we heat it to a certain degree, that protein is going to denature. So now imagine unraveling part of that tangled up ball of yarn. Now, instead of having that nice curved line that I drew with my magic marker, I've got this series of dashes. Well, it's not going to fit into that same spot in my hand, that curved C shape between my index finger and thumb. It's just not going to fit in there anymore. Mm-hmm. And that's what happens with these conformational epitopes when they go through heating to a certain degree, and usually that's when they're baked through an oven. That protein can unwind. And so then the way we recognize it becomes different. So, some of these foods, as we start to find with time and avoidance that allergenicity goes down, when it comes to introduction, often we'll start in that baked form. And as kids start to, ingest that food, let's say it's baked egg or whatever, or baked milk, for a period of time, they continue to go on to develop, improved immune tolerance. And then we can hopefully, in a lot of kids, go on to introduce that food in the regular form. And then those children would then grow out of their food allergies. So that's kind of part of the hope of, with parents and children with food allergies of, we hope that these kids grow out of this stuff. That's kind of the direction it goes, is once we start to, have that time and avoidance and we start to see downtrending of antibody levels and, we think that kids are now in the realm of being able to grow out of those things, then we want to go ahead and get them into the diet and allow the immune system to continue to develop immune tolerance over time.
That's great. And so that's kind of what we've been working on, is an egg ladder at this point and kind of going up rung by rung. And so it's, I will say, like, doing a lot of it, we've been doing it at home is, it is scary as a parent. Those first few jumps, I was like, oh man, I'm really scared. But we're starting to get some confidence. And then of course, being on top of it so that she's having that enough and that we're, making sure that we're still being safe. Right. So it's, it is a challenge for sure, but I'm super hopeful that for her sake, at least on the egg side, that we're going to be fully successful. We're not there yet, but we're getting there.
I'll definitely keep my good thoughts in her direction. Hopefully she'll do great with that.
No, thank you. So I guess I'm thinking back now maybe to like the pregnancy stage. And a lot of people wonder, like, is there something we can do to prevent environmental or food allergies? And is there a genetic component at all? And I think that's something we've struggled with. Like, why did this happen? Like, both my husband and I don't have food allergies. We both have environmental allergies, but it was a real surprise when the egg allergy came out for us. And thinking about that stage, is there a genetic component, and can there be anything that we do to prevent them?
It's such a good question. And I think there's just so many theories as to really why children develop food allergies. And so, one of the thoughts for a long time has been, the timing of exposure of allergens, of food allergens. And so I think, the pendulum has really swung in all directions here. And I think the direction that we're going in right now is very positive. And I think that was really kicked off with the LEAP trial that was published in 2015, which specifically looked at peanut, but with significant decreased rates of the development of peanut allergy in infants who were at high risk, who were randomized to introduce peanut early on. So now I think there's definitely much more of a push for earlier introduction of these more highly allergenic foods. And I think for a period of time when, we were really advocating the opposite, really was, delay introduction of some of the more highly allergenic foods, I think that really contributed to the significant rise in food allergy that we saw, for many years. And I think, the data shows, I forget, over a 10-year period from, the time that I finished high school to the time, that I was in my residency, I think food allergy went up close to 20%, which is just, astronomical when you really think about it. And now we've got over 15 million Americans dealing with food allergy. Yeah. So, I think part of what we see is that component of, our genetics and our environment, and that's allergies in general. And there is certainly a mix, but in this case, I would say it's certainly not a monogenic defect that like mom has it, so baby has it, or dad has it, so baby has it, or whatever. So generally, we will see that there is some family history of atopy to some degree. So whether the parents have had a history of eczema or environmental allergies or asthma, even if they don't have a history of food allergy themselves, some of those genes go into the development of our children, then developing their own version of atopy. So many children who have food allergy may have eczema when they're infants and toddlers. And one way that we find that children may develop food allergy is even through transdermal exposure through their inflamed skin. And that may skew the immune response to develop more of an allergic profile versus having our first introduction be through the gut, which is really in the place where we develop the most immune tolerance. So I think that it's just really tough because for any parent whose child gets diagnosed with food allergy, I think that there's a lot of stress there. And it's certainly, something that parents shouldn't feel guilty about because it's such a multifactorial, development issue that, there's just so many things that play a role into it. I think that there's not one thing that somebody did for their child to go on to develop food allergy. It's just such a mix. And that's hard, I think, for families and for parents especially to come to terms with. But I think it's important for parents to really release that guilty feeling and just recognize this is just what it is. It's not your fault. Let's work through, that education and that emergency preparedness moving forward.
Yeah, absolutely. I, for sure, definitely the parent guilt. And then I've seen also that play out within my daughter where there's sort of that questioning about, well, why do I have this? Nobody else that I know has this. Why am I different? What happened for me? Sort of those kind of questions as well. And certainly that's been our messaging that, we just have to move forward kind of thing. And unfortunately, we all get different things that happen to us in life. But yeah, there's definitely that stress and anxiety within the child too that I've noticed. And I wondered if that's something that, do you address at all in your work is, and whether it's maybe a referral for therapy or things like that I think a lot of children with food allergies tend to be stressed about it.
Yeah, I can definitely, reflect on many patient visits that I've had where not only the patient, the child, but the parent too. There's a lot of stress and anxiety around food allergy. And part of the way that I like to manage it is, I like to talk to children during their visit, like they're running the show. It's about them, and kids need to, especially kids with food allergy, need to understand, what's going on with them. And I think empowering children to recognize that, they know what their allergens are. They know that they have an emergency plan and they have emergency medicine just in case. I think that helps to some degree to kind of lessen some of that anxiety because they feel more in control of it versus, just that chance of running through life and having that accidental ingestion that doesn't go away. That chance is always going to be there, but knowing that they can kind of take ownership and that they can, they know what they need to avoid and they know that they have a plan to manage it, I think helps. So I think empowering kids to feel, in control, it helps for them to combat that anxiety as well.
Yeah, no, that sounds really appropriate. And I've heard too, and of course my daughter's younger, but that it can be really challenging during the teen years as well, where children are, naturally maybe testing things and making sure that they're still diligent.
Yeah, teenagers, I think, are just a tough group in general, and not just with food allergy, but with a lot of different medical problems and management. And I think part of that has to do with the fact that, as kids going to visits, if their, doctor is not engaging them in their own healthcare, then they kind of tune out of it a little bit and they don't internalize, I think, the message as much. And that really can be problematic for young adults who went through childhood and really grow into grownups that have no idea what their medical problems are, even though they've been attending these visits with their parents, but the conversation hasn't been with them. So yeah, teenagers are a little bit tricky. But I think, I just like to empower the patient as the person who's in charge. And I do that starting with, young children all the way up through adolescents and teens and adults. And, the patient needs to know what's going on. So that definitely, I think, helps for them to feel empowered to be able to manage this stuff and to not take those risks. But it's harder, they're eating out of the house more often. So they just need to have that increased level of awareness and care.
No, that makes sense. And it totally backs up what the parent's telling them as well, which can be really helpful, I'm sure.
Absolutely. Yep. It's always easier to have that, extra expert in your corner to say, yep, I told you so, but in a nicer way.
Yeah. Yes. So another thing that I've heard happening is people who maybe have never had an allergy and then all of a sudden they're 40, 50 and they're allergic to something and, it's quite severe. Like, for example, like a mold allergy, or you mentioned earlier that food allergies sometimes can come later in life. So I just wondered why that sometimes happens.
So there is an interesting aspect of food allergy that I like to think about I kind of think about it as a secondary form of food allergy. And this is something that is called the pollen food allergy syndrome, or some people refer to this as the oral allergy syndrome. And the reason why is because these allergenic proteins that we find in various fresh fruits and vegetables, nuts, seeds, and legumes are cross-reactive with allergenic proteins that we find in pollen allergens. So as people will develop or change their environmental allergies over time, sometimes these problems with food go hand in hand. And for example, here in Virginia where I live, we have a really vicious tree pollen season in the springtime. We have a lot of different species of trees in our area that are very problematic for both children and adults. And very common around here are the trees in the birch family, which include oak, which is what we like to refer to as like the yellow dust of spring that covers everything. But oak, birch, beech, and alder are trees that are all in the same family. Up to 40% of individuals with these environmental allergens, they may develop problems of this pollen food allergy syndrome. And often this is going to manifest with oral cavity symptoms of itching, tingling, or mild swelling of the lips, the tongue, the gums, the roof of the mouth, or the back of the throat. And most of the time we see this with ingestion of these various foods in the raw form. However, over 90% of individuals can then tolerate those foods in the cooked form. So a great example is biting into an apple and getting, lip swelling and mouth tingling, yet that same patient can sit down and have a slice of apple pie without any problems. In fact, I saw a little boy today who is about the same age as your daughter, and he had new symptoms with peaches. And so it's the same family, that birch family of trees, and he had very significant allergies. So interesting, when we tested him for peach, his testing to peach was negative, and you'll see a mix. So some people might have positive testing for those foods. Some may be equivocal or borderline, and some the test may be completely negative. However, the symptoms are the same, and the management really is the same no matter how the test results come back for these correlating foods when we see large sensitization to those correlating pollens. So that's one problem that we see in adulthood. There's kind of two others aside from pollen food allergy that fall into this group. One is a problem of adults who develop dust mite allergy or house dust mite allergy, which is an environmental allergen. It's an inhalant allergen that is present in all of our homes. Doesn't matter how often we clean or dust, but they're these little microscopic mites that they predominantly live in the pillow, the mattress, our sheets and blankets, the sofa, etc. And as adults develop dust mite allergy, sometimes they become reactive to various crustaceans, especially shrimp. And the reason why is because the allergenic protein is found in the exoskeleton of the dust mites, and it's also found in the exoskeleton of shellfish, and that's called trypamycin. So we see that it's very similar to the cross-reactivity we see with pollen food allergy, with the exception of the fact that it's literally the same allergenic protein. It's just both in environmental and food allergens. So that we see. And then I would say the third group of food allergies that we see in adults is a very interesting and unique type of food allergy that we see in this part of the country where I live, here in Virginia. And this is an allergy that may develop to a specific carbohydrate that's found in mammalian red meat, such as, beef, pork, lamb, venison. And this carbohydrate, which is called galactose alpha-1,3 galactose, or we've nicknamed it alpha-gal, this allergy to this carbohydrate, and some people will develop following a tick bite with something called the Lone Star tick, which is endemic in our area here. And so those individuals can manifest with symptoms of anaphylaxis, but in a delayed setting. So typically when we're talking about anaphylaxis, as we talked about earlier, we're talking about symptoms that happen within seconds to minutes to maybe an hour or two following an ingestion, and usually no later than that. However, in this example with alpha-gal allergy, usually we're going to see symptoms of anaphylaxis within 4 to 6 hours of an ingestion. And the reason why is because we have to start to digest this mammalian meat in order for this carbohydrate entity to be even available for our immune system to see. And that just takes time. So that's that's a very interesting, food allergy scenario that we tend to see in this part of the country because of the presence of these Lone Star ticks. So very fascinating stuff. Almost sounds like science fiction, but it's totally real.
Yeah, that is fascinating. And that must be really hard to pick up on what it is. Like if the reaction's 4 to 6 hours after, I could see that, kind of stumping people for a while.
For sure. And on the contrary of that, I do see a fairly large population of patients who have a totally different problem that manifests, though, also with symptoms of anaphylaxis. And this is a problem where their mast cells are hyperreactive or hyperresponsive, and those individuals may have anaphylaxis without an obvious trigger, and they're often misdiagnosed with food allergy or many food allergies because they're having these symptoms very often, but without necessarily having a trigger. The problem is really just with their cells not behaving properly. So anaphylaxis without an obvious trigger is very, very tricky, and requires significant evaluation for sure.
And so then the reaction is treated with epinephrine for all of those?
It is because it doesn't matter what the trigger for it is, the management is really going to be the same. Yeah.
Mm-hmm. Even for the mast cell activation piece. Yeah.
Yep. So all of these patients who have mast cell disorders, specifically mast cell activation syndrome is what we're talking about here. They all just as much need an emergency plan and emergency treatment medication, with good instructions of what to do and when. So that's a tricky problem to manage, but I'm becoming more adept at that as my patient population is substantially growing. For those patients. So, it's just more people to help, which is great.
Yeah. And I've never heard of the pollen food one, but my son also has oak and birch. So I will be watching for that. That's interesting.
Yeah. I usually will provide parents with kind of a list. Like, for example, this little boy that I saw today with symptoms after ingestion of raw peaches, so I'll provide to his mom and his dad a good list of what are all the foods that are cross-reactive in this category. And the point of that is not to say don't eat them, but the point of them is to say to be aware of them because, I think sometimes as parents too, your kid's sitting at the dinner table and they're like pushing their carrots around and they don't want to eat it. And it's easy to say like, I really want you to eat some carrots before you finish your dinner or whatever, right? You can't go on to whatever the treat is after your dinner if you can't eat carrots. And sometimes recognizing, the reason why your child may not be eating them is not because they want to be difficult, but they may be having symptoms that don't make them feel good, that they can't verbalize very well what they're experiencing. So just having that knowledge of what are the foods that are associated with these allergens, I think is helpful to kind of just be able to really assess what's going on in your household.
Absolutely. I totally agree. And I've talked about that on the podcast a little bit, that I was never that parent that was, you've got to eat everything on your plate. And I really honestly thank God now, because I think we could have ended up in a lot more situations, especially with my daughter, because it took until she was able to verbalize at about 18 months that her lips were burning. Mm-hmm. That's when I finally realized something was going on allergy wise. Before that, I just thought, oh, you know what? She's just really picky. Like she doesn't like baked goods. She doesn't like eggs. She doesn't like, and I couldn't find, it took me forever to figure out that common theme and she couldn't tell me. So right. I totally agree that sometimes they know a lot more than we think.
Right. And it's funny too, because even as kids start to describe things, sometimes they don't describe them in the way that makes sense to us as adults.
Yeah.
Like they'll use the word spicy or something and you're like, that's not spicy, but maybe their lips feel like they're tingling or something, like they would if you put some, whatever, chili pepper on your lips or something like that. So, they may use words that don't reflect how you recognize foods to be, but it's interesting to kind of see it through their eyes and to start to understand their experience.
Yeah, no, absolutely. And then even still, it took me a while and I was like, her lips are burning and I could see a little swelling. And that's when I finally thought, oh my gosh, like this is an allergy situation and,
sure.
Had no forewarning, she was pretty little. So,
right.
And just on food allergies, like I've noticed over the years, and I obviously pay more attention because I have a child with food allergies, but just there can be a real stigma for those children, either in the media, in the classroom, and it does definitely help if you do have a really allergy conscious school or school board. But I just wondered if you have any thoughts or experience in what can be done to sort of reduce that stigma around food allergies and even just increasing the overall awareness for others.
Sure. I mean, I think certainly something like this podcast that you're putting out is so good because, I mean, think about your listenership and so many people that may not have known so much information about food allergy and just to expand the minds of others. But I think it's something that needs to be talked about within the community. And I think it's something that patients and families need to know there's not anything wrong with them. This is just who they are, and they always need to be able to speak up about their food allergens. In fact, just maybe a week or two ago, I saw a gentleman who's a young adult. He's a new young adult who's moved away from home, and for him, it's hard when he maybe goes to a restaurant with his friends to speak up about that being in the presence of other people eating shellfish makes him feel sick and makes him feel bad. And so, we just really worked on kind of empowering him to know about how to talk about it with people who care about him and who he cares about. So that way he doesn't, end up in a situation that could be potentially dangerous or even life-threatening to him. So, it's important for everyone to understand that that this is just part of what we experience, now more so than ever. So, a lot of, education and awareness, even things like, the Teal Pumpkin Project, which is a specific tool that is out in the world around Halloween time to really help protect our food allergy kids when it comes to, having food allergy safe treats at Halloween time and things like that. So, there's I think a lot of push towards a lot of education in our communities. And I think that that's really helpful to build awareness and to help kids with food allergies just feel like normal kids, because they really are. They're really just normal kids.
Absolutely. I love the teal pumpkin idea. And I always try to think like, ooh, what could I send that's a non-food thing whenever there's celebrations? And interestingly, this year, my children were able to attend in-person school. So our schools were open most of the year, but with COVID, they weren't allowed to have communal treats brought in that were shared. Sure. It was something that I actually noticed was one positive thing for us is there was a lot less of this having her felt, to feel left out that she couldn't participate in whatever the treat was, or having to make sure that she had an alternative treat, which I always leave,
Sure.
A big bag of treats at the school for her with the teacher so that if something does come in that I'm not aware of. But, this year it was just kind of less of an issue. And I sort of thought, yeah, that was, one at least positive thing for her. She didn't feel that push so much. So,
Absolutely.
Yeah, I think
I've seen that in my school as well. Same thing.
Yeah, for sure. So I just wondered if there were any other, tools or advice that you would kind of want to recommend to listeners before we wrap up, either whether it's, to increase their awareness or for someone who is struggling with allergies.
Well, I would say one tip is that I think sometimes with primary care, and maybe this is more so with adults, but I think primary care doctors have a really tough job because there's so many things that need to be addressed in such a, minuscule amount of time that, that's allowable any longer. And it's just so hard to manage things like allergy. And so I think, maybe this is the parent of a child with eczema that just doesn't feel like they're getting better with the guidance they're getting from primary care. Or maybe it's an adult who has, bad symptoms of rhinitis or a chronic cough that may just be getting kind of brushed over because there's too many other things to address. There are specialists out there like me who, take care of children and adults who are suffering with allergies and other problems like recurrent infections. And, we help patients to overcome these burdens, to get to the bottom of the problems that are causing their symptoms, and to help people find solutions, not necessarily with more medications, but often with less medications, but a lot of education and a lot of time to really dedicate to improving the health and well-being of children and adults who are suffering. So, if you're finding that either you or your child, you're not getting, what you need in the realm of allergy, from where you are starting from, seek out care from a specialist. And, it's funny because even when I think back to those early days, remember when I was a resident and I was thinking about, pursuing cardiology, and I thought, I don't know if that's for me, maybe I'm going to try something else. And I remember the very first time I started expressing, I think I'm going to pursue allergy and clinical immunology. And I remember, even just such a common misconception of even some other trainees at my institution were like, oh, you're going to be dealing with like sniffling and coughing for the rest of your life. And it's like, yeah, but what a difference all of this makes for our patients. So anyhow, I would say, my biggest advice is, be your greatest healthcare advocate and get the care that you need, because there's people like me who are out here who are available to help and to make a tremendous difference in the trajectory of the way people live. So it's really awesome, super rewarding.
No, that's great advice. You're right. You do have to definitely be your own advocate or your child's advocate
Sure.
in order to be feeling the best. So that's great. So how can listeners find out more about you and your clinic, either social media, online? What are all the places?
So my private practice is called Kaufman Allergy, Asthma, and Immunology, and we are located in Northern Virginia in the suburb of Washington, D.C. called Vienna. And so if you're in the Northern Virginia area, please come and see me in the office. You can find out more about me and my practice online at kaufmanallergy.com, which is KAUFMAN allergy.com. And on social media, you can mostly find me on Facebook at Kaufman Allergy or on Instagram at dr.kaufmanallergy.
Perfect. So I will link up to those in the show notes, and then people can click away and find out more about you. So thank you so much, Dr. Kaufman. I think this was a wonderful Allergy 101 for people, and even beyond that, into looking at some more specifics and digging into certain areas. I really appreciate your time and your expertise today. So thank you so much.
It's been a pleasure. Thank you.
Thank you so much to Dr. Karen Kaufman for joining us this week on the Learning to Slay the Beast podcast. I learned so much, not only about environmental allergies, but also food allergies. And it's been something that I feel like I can't learn enough about, especially when it comes to protecting your child or protecting others in your community and understanding what is really going on with both environmental and food allergies. So if you'd like to learn more about Dr. Kaufman, as she mentioned, you can visit her website, which is www.kaufmanallergy.com, or visit her on Instagram at dr.kaufmanallergy. Thanks again for joining us, and have a great week. I wrote a book, and I am so excited to share it with all of you. Pendulum by S.E. German is now available. The story follows a young boy named Ben as he changes from a silly, energetic, happy little guy to a boy that is anxious, obsessive, emotional, angry, and depressed. After visiting 20 doctors and getting 7 misdiagnoses, his mental health declining even further, he's finally diagnosed with PANDAS, a neuroimmune disorder. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Infections. It's a little known and understood disorder without a cure. At 8 years old, Ben and his family move to a new city to start a new life. He gains confidence, navigates his first crush, and plays competitive sports. Ben encounters many challenges in a new school while also coping with his mental health issues and trying to understand and accept himself and his disorder. Ben shares how he handles all the trials of being a middle grader and having PANDAS, and his unique outlook on both the disorder and his life. Pendulum is available at Amazon.com, Amazon.ca, and also through the Friesen Press bookstore. It can be found in hardcover, paperback, and the ebook. I hope you will check it out soon. I'm excited to announce the launch of my author website, www.se-german.com. On this website, you can find out all the information about my publications, focused areas on my novel, Pendulum by S.E. German, where there are questions for parents as you work through the novel with your children, as well as teacher resources that can be used in the classroom. There's also information about the Learning to Slay the Beast podcast and recent press. Please visit www.se-german.com. Thank you for listening to the Learning to Slay the Beast podcast. Please keep in mind this podcast is not intended to be medical or professional advice. If you are looking for that advice, please seek that out from a professional. If you'd like to hear more from me, you can visit my blog, www.theallergybeast.wordpress.com, or follow me online at Sarah Lady Gluten on Instagram, SarahLadyGluten, or the Facebook page, Sarah-Lady Gluten. If you do like the podcast, please consider subscribing so that you will get the podcast update every week, and or reviewing the podcast on whatever platform you listen to. Thanks again and have a great week.